Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. March is Essential Tremor Awareness Month. An estimated 7 to 10 million Americans suffer from essential tremor, which is a neurological condition that causes trembling of the hands, head, voice, legs, or trunk. It's often confused with Parkinson's disease, even though essential tremor is 8 times more common. Today we're talking about essential tremor, its cause and treatments with Dr. Ann Murray, neurologist at the WVU Rockefeller Neuroscience Institute. Welcome, Dr. Murray, to Tuesday Talks.
So happy to be here on such an important topic. Thanks for having me.
Good to have you. We encourage you to post any essential tremor questions you may have in the comments section below, and we'll try to answer them live. Okay, so we just mentioned that essential tremor is often confused with Parkinson's disease. And until recently, I kind of thought they were the same thing too. But they're not. So what is the difference between Parkinson's disease and essential tremor?
Yeah, a great question, and often can be very confusing to both kind of the patient family and even honestly kind of non-neurologists kind of in the field of medicine. And so really, when we think about them, they're very fundamentally different, meaning they affect the brain differently. Although they're both brain diseases, they can cause entirely different symptoms. So even the tremor in Parkinson's disease is often very different than the tremor in essential tremor.
How so?
So the tremor in Parkinson's disease is actually much more common to be when patients are having their hands at rest, kind of resting in their lap, or kind of resting on a couch, resting in a steering wheel, something like that. And in essential tremor, the tremor itself is much more of an action tremor. We call it an action tremor because it's when they're doing something, like holding a fork or holding a knife or holding a cup or trying to write my name. And in addition to tremor and Parkinson's is actually a bigger kind of full body disease where the disease itself more commonly causes the slowness of movement, which is entirely different than tremor. A little nuanced, of course, because this is kind of the field of neurology, but the take-home is Parkinson's causes lots of other physical features like walking changes and slowness of movement in addition to tremor, whereas essential tremor itself really causes primarily tremor, especially when people are kind of eating, drinking, using their hands. Both can impact quality of life, but we treat them entirely differently because they're truly different diseases.
Probably affect different parts of the brain.
Exactly. So kind of similar circuitry, but an entirely different pattern of problem. Absolutely.
Okay. So essential tremor has a huge impact not only on patients, but on their families. Can you talk a little bit about that?
Absolutely. So, years and years ago, we used to call essential tremor benign essential tremor.
Yeah.
Anybody that's had tremor understands it's not that benign. Now, we're very happy that essential tremor does not decrease life expectancy, right? So it is not increasing mortality, but there's a big difference between it not increasing mortality versus it being benign. And I often reassure patients that, listen, we understand this isn't benign, right? Because everything you do all day long, boom, there the tremor is. You want to brush your teeth in the morning, there the tremor is. You want to drink your coffee, there the tremor is. You want to write your name, there the tremor is. And it's not only impacting the patient, much like you said, it's really hard for loved ones, right? It's hard for loved ones to watch their loved ones struggle. And those are just daily activities. That's not even counting things like fishing and hunting or sewing, crocheting, cooking, all these other things that are a huge part of quality of life. Yeah. More than just being alive, it's about living. And that's why we absolutely recognize that essential tremor is a huge impact in patients' quality of life. And of course, their loved ones are going to appreciate that as well.
So what are the symptoms of essential tremor?
So we really define it by the characteristics of the tremor. So when we say characteristics, we mean specifically what makes the tremor better or worse. So essential tremor is really defined by what we call an action tremor. Again, it's present more when we go to do something, when we're kind of holding something, when we're moving something. And that kind of, as we activate those muscles, so say it's in my hands, as I activate those muscles, that's what brings the tremor out. It can also be in the head and voice, as you had mentioned. It can be in the legs, and it's really, though, still defined of if somebody has a voice tremor, it's not there when they're not speaking, it's when they go to speak and they have that quiver to their voice. And so again, the entire disease is defined by that action component of the tremor. It's present when they're using those muscles that have the tremor involved.
Do we know what causes essential tremor?
Great question. So yes and no. Do we know exactly what causes it? No. We do know there's often a big genetic predisposition.
Okay.
So we know that it often runs in families, right? Often we'll ask and they'll say, oh yeah, grandpa had tremor, my dad had tremor, and now I have tremor. It doesn't have to run in families though. Sometimes people just get it. And again, we think that it's probably complicated because we do think that although we don't have one exact cause of it, we think probably lots of different factors go in, genetic factors, and then just kind of saying that, listen, this isn't unlike lots of things. This isn't necessarily a complete failure of the nervous system. It's often what I like to describe as a circuitry issue. This is kind of an abnormal signaling. And so again, when we think about it, it doesn't decrease life expectancy. So it's pretty common in the population, actually, up to 5% of the population, which is kind of where we get this. It's a lot of people. So there's lots of variability to it that we don't know exactly what triggers one person to have it from somebody else. We know there's lots of these factors that contribute that, again, really kind of cause somebody to have it eventually in their life.
So how do you diagnose essential tremor?
The main way we diagnose is really clinical. So it's seeing kind of somebody that understands what tremor looks like and how we diagnose it. Somebody like myself or anybody at the movement clinic. And it's really defined clinically, so there's diagnostic criteria. So that can be sometimes frustrating for people, right? We don't have a blood test that I can just get and say, oh yes, this is essential tremor. But the good news is we know what it looks like, we know how to treat it, and the biggest first step, of course, is just seeking help and saying, hey, what is this and how can we get it better?
You don't have to live with it.
You don't have to live with it. That is a huge theme that I talk to all my patients about, is to say that, listen, we're happy this isn't life-threatening, but life is more than just being alive. It's about how we live. Let's treat it so you can live your life.
Is this a progressive disease? Can it get worse?
It is. So that's a really great question. So there's actually kind of a bimodal pattern of onset. What I mean by that is there's two age groups that it often presents. So sometimes actually younger people can have it. So actually
Really?
Kind of in late teens, early 20s is not an uncommon time for tremor to start. Usually if it starts at that young age though, it doesn't really progress significantly. They might notice, oh yeah, I'm in chemistry lab and I have a little tremulousness when I go to kind of, pipette something in or when I go to kind of cut something. Very commonly though, by the time people get into their 60s is the second most common pattern, or kind of actually probably the most common, kind of in adulthood, is in patients' 60s. And when it starts in their 60s, it often can kind of get worse over time. When we say worsening over time, it's important to know that it's going to be day-to-day worsening. It's not going to be worse on Tuesday than it was on Monday, but it's going to be worse over 5, 10, 15, 20 years. So it's very slowly progressing. Absolutely, but it is progressing. So we do expect things to kind of change over time.
Who's most likely to get essential tremor? Is anybody more at risk?
So it's a good question. Again, genetics would be the biggest risk factor. I think it a little bit gets challenging because I think truly we probably underappreciate the number of people that have tremor. Meaning even the statistics that we have are really patients that have sought out care, right? And I think lots and lots of people probably just live with it.
Yeah.
And so I would say anybody's at risk, right? Anybody in the population is at risk of having tremor. I don't mean that in a scary way. I mean that in a, listen, we have lots of treatments. If you're suffering from tremor, come see us. There's nothing you've done wrong to cause tremor. It's more to say, listen, this can just happen, but we have lots of good treatment options.
Yeah, so let's talk about some of those treatment options. What are the treatment options? Because you don't have to live with it, right?
Absolutely. That is if there's one message that anybody takes home from today, it's that you don't have to live with it. We have too many tricks up our sleeve to fix it, to improve your quality of life.
And a lot of progress recently, too.
Absolutely. So the way I like to talk to patients about it is that the treatment modalities are a spectrum. Of course, kind of if I start with a little bit of tremor, the first step is just to say, listen, if I go to write and I have tremor, we can use things like weighted pens or kind of, better, bigger grips to make it a little bit easier. We have weighted utensils that we can use, like forks and knives. Okay. And those aren't treating the tremor, right? But it's helping the function.
Yeah.
And functionality is a big thing. And the nicest thing about all that stuff, there's no possible side effect, right?
Right.
This isn't a medication. This isn't a medical therapy. This is adaptive equipment, right?
Right,
It's to say, hey, how can I use this thing to make my function better?
Could be for anybody.
Exactly.
Yeah.
Could be for anybody. But If that doesn't work, if that doesn't give you the quality of life you want, then we absolutely should think about medications. These are things like sometimes we use a medicine called propranolol. It's a blood pressure medicine, actually. But the idea of it is that, again, fundamentally we think tremor is coming from the circuitry firing in the brain that is causing that oscillation. And all the medicine that we use tries to quiet down that kind of firing. And so when we quiet down that firing, it quiets down the tremor. Propranolol is one of those medicines. So we think that it kind of calms down that firing a little bit and quiets the tremor. Another medicine that we often use is a medicine called primidone. So those are our top 2 medications we can use. Again, both very well tolerated, easy to use, minimal side effects. And I like to remind people we are not going to hurt you with this medicine. It's worth a try, right?
Are they effective? How effective
Highly
are
effective. So we think that most of the time, at least 50% reduction in tremor with these medicines. So not insignificant, right? Easy enough to try. And of course, we customize those medicines for each individual patient and make sure that we're, again, addressing all their kind of needs, as well as their comorbidities, right? What other kind of healthcare problems do they have? And does this medicine fit well with that kind of the rest of the medications they might be on? But that's not the only treatment we have. And if those medications fail or we're not able to tolerate them, right? We have plenty of patients that say, listen, when I take this propranolol medicine, it does great for my tremor, but I'm tired, or it drops my blood pressure too much, or it drops my heart rate, or I just don't want to be on it, right?
Right.
Then we can really look at it and say, well, what other treatments do we have? And we have advanced therapies like surgery and ultrasound, kind of brain therapies where we actually do brain modulation. We go in and kind of change that circuitry. And
Is that DBS?
That is one of the
which stands
therapies.
for?
Deep Brain Stimulation.
Okay, let's start with Deep Brain Stimulation.
Perfect.
What is that?
So Deep Brain Stimulation is a fascinating technology. So we realized years ago, actually, when we would kind of change the circuitry in the deep part of the brain, it actually calms that tremor down. And so one of the advances in medicine have been this deep brain stimulation. That's where we make a little incision in the skull. We put a little tiny wire in the deep part of the brain, right where those tremor cells are firing.
Okay.
And when we connect that wire to a little battery we put in the chest, just like a pacemaker battery, like somebody might have from a heart disease, and we can put electricity through that wire, and when we do that, it quiets those tremor cells and it quiets the tremor.
So it's like a pacemaker for the brain.
It is exactly like a pacemaker for the brain, that we want to quiet that abnormal signal so that it normalizes it and it really treats tremor. And this has been around since the 1990s. This isn't experimental. This isn't kind of, way out there. This is standard of care. This is highly effective, dramatic improvement in quality of life, and very well tolerated.
Wow. Okay. I didn't realize it had been around that long.
Yeah. So you're right. Yes, we've been helping people, but definitely still need to kind of explain it because it does seem overwhelming to think about often.
Yeah. Who's a good candidate for deep brain stimulation?
Great question. So really, I think anybody that's suffering from disabling tremor. And it's more than just, again, can I just not eat? It's more of, does your tremor impact your quality of life, right? So for instance, if somebody is a welder, even a little bit of tremor is going to be a dramatic quality of life change. If somebody's a teacher, a little bit of tremor is going to be a dramatic quality of life impact. And so any of those patients would be candidates. Really, we have a robust team here, a comprehensive team to evaluate patients. And I would really say if you're thinking about any procedure for your tremor, go to a comprehensive place. Go to a place that does this all the time. That's where you want to go because these are highly sophisticated therapies. And we really want to make sure we're applying the right therapy for you as an individual or anybody that's affected with tremor. But really, anybody would be potentially eligible. It's more about kind of the rest of the story and what they're interested in doing treatment-wise.
Okay. Now, something more recently, another therapy is Focused Ultrasound. Tell me a little bit about what exactly Focused Ultrasound is and how it works in stopping the shaking.
Absolutely. So this just got FDA approved in 2017, and we were very happy to be one of the early sites to offer this to our patients. So the way this works is that it's this fancy kind of technology where we put this fancy helmet on somebody's head that has tremor, and we put them in an MRI machine. So just like any old MRI machine that many people have had an MRI before, but you put this fancy helmet on your head, and this helmet is made of over 1,000 transducers. those transducers send out sound waves. It's ultrasonic, so we can't hear it, much like sonar that bats use, but it still creates this vibration, and we can focus these sound waves in this deep part of the brain, right where we put that lead, the same exact anatomy, right? Right where we think those tremor cells live in the brain. We focus this energy right on those tremor cells, and it makes an intentional lesion. It burns those tremor cells. And of course, in burning them, it quiets down the tremor.
Because they're the troublemaker cells.
Exactly, you got it. So we're targeting that therapy, and we have a really sophisticated way to target it. The most amazing thing of all about ultrasound is that we can do this without ever making an incision. This isn't surgery, right?
Wow.
We can do that kind of putting this helmet on somebody's head. And so it really causes a permanent lesion. So we take it very serious, and of course, it has its own risk benefits with it, but it's pretty amazing because this is not going under anesthesia. This is not having a post-surgical recovery. This is not a surgery. People can go home the same day.
And because I was there when you guys did the first one, and it just blew my mind.
Yeah.
I was amazed at how, instantly, like within, it was like 45 minutes to an
amazing.
hour.
You're right.
To go from this to
fix
that.
I often kind of, as I'm describing to patients, one of the coolest things about focused ultrasound, period, is that instantaneous effect. You'll come in on a Tuesday morning with tremor, and by Tuesday at noon, your tremor's treated. And so, no, it's pretty amazing. And the other really nice thing from my standpoint, for healthcare professionals out there kind of interested, is that we're not only monitoring tremor efficacy as we're doing that treatment or kind of tremor reduction, we're also monitoring for side effects. We're also making sure this is safe, right? And so that is a really, really big piece of both DBS, deep brain stimulation, and focused ultrasound. Safety cannot be underestimated. And so both of those are highly safe, and our entire team is assessing that throughout the entire procedure. So we think these are highly effective, and again, we have a really, really good safety profile, which is exactly what you want in any therapy, right?
Absolutely.
It's not just about treating tremor, it's about improving quality of life and doing so without causing any additional side effect.
So are the results permanent?
Yes, so we are making a permanent lesion. Now, kind of tying in the idea of permanence is tricky in a technology that's only been out a handful of years.
Right.
So far the data looks really, really good. We have post kind of study 5-year data that looks great, kind of with focused ultrasound, that for the patients that did well initially, their tremors are well controlled at 5 years. Of course, the technology is new, so time will tell ultimately, how well does it control it at 10, 20, 30 years. But so far it looks great, and our patients have been very pleased kind of with the results.
So who would be a good candidate for focused ultrasound?
So either it's the same kind of population that would be a good candidate for any of these tremor treatments, actually. What we often see in real life, though, is people have their own kind of personal preferences, right? Some people that kind of live close and really, are more interested in kind of deep brain stimulation surgery are fine. That's a reasonable option. But at the same time, lots of people say to me, I don't care how good surgery is, I never want to have surgery. And that's okay too, right? Because now we have this other really amazing technology. So it's the same patient population. The nicest thing about focused ultrasound, though, are patients that have a history of heart disease or have some operative risk, right? Now have an option to get a therapeutic procedure for their tremor that doesn't involve surgery. So it does kind of expand our patient population a little bit, being able to do this without actually having to have surgery.
No incisions, and it works instantly.
Right.
I still can't get over that. That's just fascinating. So we've been doing focused ultrasound here at the Rockefeller Neuroscience Institute for a few years. How has that evolved? Because you just recently treated the 100th patient.
You're right.
With focused ultrasound for essential tremor. So I imagine there's been some evolution over the last few years.
Absolutely. So I think obviously as we've kind of done more cases, we've absolutely kind of gotten a better feel of exactly how to walk patients through it, right? To kind of walk them through what to expect, kind of what we want to do. And so we've been really happy, again, if we look at just kind of the medical results side, we've been really happy. Out of our 100 patients, we've had really, really great tremor control with really, really minimal kind of ultimately any big side effects, which is really what you want, right? But one of the most amazing things to me through this journey has been more than the individual patient, although we've been so thrilled with our individual patient outcomes. It's been about the conversation around tremor. Because I think for the first time in a long time, patients are actually excited, and their family members are actually excited to say, hey, there's this really amazing technology that I don't have to have surgery anymore to get my tremors better. And so that's really created this buzz and this energy in the entire region. So not just in West Virginia, which of course we're super ecstatic about that we can offer this to our residents, but also to the entire region, to the kind of states around us and across the country, actually. That again, it's really changing the conversation around tremor, much like we've said already, and saying, listen, we have so many tricks up our sleeve, we have so many tools in our toolbox. Come see somebody so we can figure out which is the best tool for you. And that's the thing that I think ultrasound has really opened that conversation more than any other treatment we've ever had. And so we've been super excited to be part of this journey.
Is ultrasound, focused ultrasound, is that considered a cure? Or can you really cure essential tremor, or is it considered a treatment?
Great question. So no, it is not considered a cure. Kind of when we define something as a cure, it would be kind of going in and normalizing that signal. Right?
Okay.
And so unfortunately, no. Deep brain stimulation doesn't cure tremor, medication doesn't cure tremor, and focused ultrasound doesn't cure tremor. But it is an amazing symptom relief, right?
Yes.
And that's kind of the biggest disabling feature of tremor. And so it is important to know that although these technologies and therapies are truly wonderful and they dramatically reduce tremor, rarely do we say your tremor is going to be zero. Right? It's really going to be kind of saying, listen, yes, you might have a touch of tremor depending on what you're doing. So the goal isn't zero tremor. The goal is a dramatic quality of life improvement. And that's exactly what we give folks. But it's always an important clarification.
Yeah, good to know. Is there any hope for finding a cure to essential tremor? Are we close?
I mean, I think, of course, the hope would definitely be there. I think some of the interesting things about it, much like we've kind of talked about, is to say that it doesn't decrease mortality, or kind of increase mortality, right? Decrease kind of life expectancy. And so it's this kind of risk-benefit assessment, right? When we think about curing a brain disease, often those can be rigorous kind of clinical trials and can sometimes come with risk, right? Because we're talking about changing brain circuitry. And so we always want to keep balancing that risk-benefit profile of saying, one, we fundamentally still need to investigate what is the true cause of essential tremor, where is the abnormality coming from, and how to normalize that abnormality will be kind of its own educational journey. So the hope, of course, is going to be there. At the same time, it's saying, in the meantime, we're going to really improve that symptom and improve quality of life while we're still figuring that piece out.
And just how exciting that, I mean, this is all being done right here. At the WVU Rockefeller Neuroscience Institute. I mean, this is like beyond cutting edge, and it's right here in our back. It's in our front yard.
It's in our front yard. That's right. Not even in the backyard, right? In the front yard.
Talk a little bit about, the experience of the whole team at the Neuroscience Institute.
So I couldn't agree more. We were very lucky. The head of the Rockefeller Neuroscience Institute, Dr. Ali Rezai, came here a couple years back and really has great experience with all of these technologies. So he is a neurosurgeon, a functional neurosurgeon that specializes in these kind of therapies. And really with his leadership and kind of the investment of WVU Medicine, we've really developed this aspect of neurosciences tremendously. So I would put our team up against anybody, not only in the country, but quite frankly in the world. We're very, very sophisticated in our technology and our application of said technology. So we have an absolutely wonderful team. I have several other neurologists that work with me. We have a whole team of neurosurgeons, neuropsychologists, neuroradiologists, and we take this team approach very, very seriously. So although we see lots of patients with tremor, every individual patient gets a customized plan. So if you're going to come here to get treated, we're going to think about you as a whole human being, a holistic care kind of approach, and making sure that we're addressing every need, whether that's physical therapy, social work, whether that's thinking kind of, cognitive issues and kind of addressing that, mood, Any of the above, in addition to your tremor, right? It's looking at it and saying, we don't want to just treat a symptom, we want to treat you as a human, and our team approach really assures that we do that, and we do that effectively. So again, it's been a wonderful journey. It's been fun to be part of that team, excited for the future, and again, we just take that patient outcome very, very serious, right? So patient care is the center of our goal more than anything else, and kind of those outcomes-driven measures are exactly what we want to go after.
It's so exciting. It really is. So before we go, the rest of the month is still Essential Tremor Awareness Month. What's the most important thing you want our viewers to know about essential tremor and treatments?
Yeah, so one of the things that I think often impacts patients, even in their families with essential tremor, that we haven't talked about is really the cosmetic aspect of it. Is kind of, I go out to eat, even if I can eat with tremor, it's that other people see me, right? It's that other people know that I have something wrong. And that gives lots of people apprehension, and that gives lots of people anxiety, and they really just want to hide it. And so what happens is they don't go out to eat anymore. They don't live their life anymore. They don't go to church anymore. They don't go to their communities and do things. And I would first just remind them that as cosmetically annoying as this is, as cosmetically frustrating as this is, it's to please don't stop living your life because of this. We have too many things that can make this better that we want you to live your life. The other piece of it is for those patients out there that have went through this journey, is to advocate for each other, right? And say, listen, hey, I was helped with tremor, and kind of, go to these people or ask your provider to kind of help, because we can get it better. It's changing the conversation, right? It's saying that, listen, even if your grandfather had it and your dad had it and they never got treated because we just said, oh yeah, well that was just grandpa, he's getting older, we can break that cycle, right? We can say, listen, we have too many treatments, we have too many options. We want you to live your life, and not just by basic things like we've talked about with eating and drinking. We want you to live your life, right? We want you to go fishing. We want you to go hunting. We want you to go crafting. We want you to do whatever you want to do. We don't want you to hide kind of the tremor anymore, because there's nothing you've done wrong to get this. Let's just fix it so you can live your life.
Well, Dr. Murray, thank you so much for giving us all this great information. It really is, it's exciting. It really is. Thank you for being here.
Well, thank you so much for having me, and super excited to get to talk about this topic.
All right, great. And that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about essential tremor treatments, visit wvumedicine.org/tremor. And join us on Tuesday Talks on March 14th, when we'll talk about Social Worker Awareness Month with Philip West, lead clinical therapist of behavioral medicine and psychiatry at the Rockefeller Neuroscience Institute. I'm Mary Ravazio Menard, and on behalf of Dr. Murray and everyone at WVU Medicine, thanks for joining us, and have a great day.